Rudo Mathivha, Head of Intensive Care Medicine at Hani Baragwanath Academic Hospital, has been calling for Charlotte Maxeke Academic Hospital to reopen. So let's chat to her about the latest developments. A very good evening to you. Good to have you with us. So you called for parts of the hospital to be reopened. It looks like that's going to happen. What's your response?
Good evening. I wasn't the lone voice that called for the opening. You had a lot of my colleagues making the same call, and I'm happy that the call has been answered, and we can decongest the public health care sector. We can help a lot of patients during this difficult time.
Okay, tell us what sort of impact this will make. What will immediately be released? How will it work?
Well, you know, we will release the congestion in casualties, in intensive care. We will be able to open intensive care beds. We will be able to repurpose beds for COVID patients, so which is where the bottleneck has been. We will be able to provide tertiary and quaternary healthcare services. The oncology services will be back online and not be fragmented all over the province, which has been inconvenient for a lot of patients having to travel to Pretoria, some from the central city to Soweto. It's actually been very difficult for people.
Yeah, I can imagine. And tell us how it's going to work now with frontline staff, not only there, also at Chris Baragwanath Hospital. Where do we stand now as far as oxygen and bed capacity is concerned?
Well, with oxygen, we're going to be standing where we have been. There is still going to be increased usage because we're dealing with a disease that requires oxygen as a mainline form of treatment. In terms of frontline staff, the Charlotte Maxeke Johannesburg Academic Hospital staff will return to their institution and be centralized there to service their patients. They won't be in different locations, and therefore will have the dedicated staff in one place serving patients there, which is now more easy to manage. The other institutions will then be able to strategize on how they actually use their staff and, you know, and institute their surge response plans. At our hospital, as I said, we have a surge response plan that we will now be able to enact as we free up more beds as the patients return to their home institution.
I know that there's a desperate scramble to get more health workers, frontline staff. What is it that's holding that process back?
Okay, Jane, they are not, you know, a dime a dozen. We don't have professional staff in South Africa. You don't just wake up and start looking for them and they come. We haven't trained enough nurses for many years. We haven't even trained enough doctors for many years, and if we do train them, we don't employ them.
Yeah.
So that's going to take time to actually start recruiting them. So we're looking at about a month running period to actually get that staff in. In the meantime, we may be using agency staff. And to attract those agency staff, we have to offer them attractive rates of remuneration, which with our current contracts, it's not very attractive. So we need to improve on that. So it's not going to happen overnight, but we can work on that a little bit quicker if we change our bureaucratic ways of doing things. And if the Premier can actually get Charlotte Maxeke Hospital opened, he can probably work on the other departments to work on those contracts, to be a little bit more attractive to our nurses And maybe he can also work on the department to call the unemployed doctors to come in and offer them contracts. As we speak, COVID posts have been frozen. There was a circular, an HR circular, that froze COVID posts that is still standing. It hasn't been retracted. It needs to be retracted so we can employ healthcare workers in COVID contract posts for the duration of this pandemic.
Okay, well, I certainly hope he's listening. Let me ask you this, lastly. I was talking to a colleague of mine earlier, and her husband is a paramedic, and he was saying that he's basically playing God at the moment. They have to choose who basically lives and who dies, who gets the sort of treatment that they needed. I should imagine that that has a devastating impact on the nursing, the frontline staff who are able to make it to work. How do they overcome that?
It's difficult. That's the only thing I can say. We have to make those kind of decisions. What can I say? Look at my face.
Yeah.
I'm tired. I'm weary. And that's my life right now. That's the life of a lot of healthcare workers. That's the life of a lot of families right now.
Well,
we cannot individualize it to a single person.
Well, all our thoughts and thanks go out to all of you who are on the front line. Rudo Mathivha, thank you for your time.